In Latin America, Ecuador is seeing one of the world's worst coronavirus outbreaks with possibly thousands dead. But that hasn't been enough to convince the president of the region's largest country, Brazil, to take the threat seriously. Here's CBS's Manuel Bojorquez.
Grim signs are everywhere that Ecuador's official death toll of about 600 has yet to catch up with reality. Bodies awaited collection for days, so many that cardboard caskets have been employed. Officials said in one province, 6,700 people died in the first 2 weeks of April, nearly 7 times the average. The virus exposed the region's economic disparities and fragile infrastructure. Social distancing was virtually impossible in overcrowded, poor neighborhoods. Dr. Luis Yepes works here in Guayaquil's largest hospital. Despite a drop in new patients, he and his staff still live apart from their families. Many healthcare workers have also become victims. We have to wait to mourn another time, he says. What we have to do is face the situation head on. In Brazil, critics fear President Jair Bolsonaro is doing just the opposite, not only encouraging maskless crowds protesting lockdowns by local officials, but joining them. Despite nearly 60,000 confirmed cases and 4,000 deaths, Bolsonaro recently fired his health minister and the justice minister angrily resigned. A lingering outbreak here could create risk for the U.S. once trade and tourism reopen. Infectious disease expert Dr. Eileen Marty is with Florida International University.
What are the chances that other countries might bring it back?
Sure, they're very high because as long as an outbreak is out of control in a nation which we are going to interact with, we can bring back the disease.
Manuel Bojorquez, CBS News, Miami.